Hi, I'm Betty Lin-Fisher, consumer columnist and medical reporter for the Akron Beacon Journal and Ohio.com. I'm here with Summa Health's Dr. Shanu Agarwal, and she's an infectious disease doctor. We are here in Summa's brand new tower. You will hear a little bit of ambient noise because we are in the tower, but we wanted to come to you live today from the new tower. And I will just say, incidentally, there's been a lot of Summa news this week. Yesterday, I just reported in today's paper that Summa announced yesterday that it will be acquired by Michigan-based Summa Health, but still have local control and local leadership with Dr. Devaney. You can read more about that at www.ohio.com. But I do these healthy actions topics. We planned for these in November and December of the previous year. So we've had this plan for 7 months. It just happens that it's a pretty heavy Summa week for me. So thank you so much, Doctor. We coordinated this past weekend on Saturday in the Beacon Journal for the Healthy Actions topic this month about Lyme disease, which we thought was really good because obviously in the summer, and thankfully that all that rain is over, but the rain really probably brought out a lot of just the moisture and people gardening. I'm not going to go over the whole column again, but basically we were talking about how and when you can find a tick and how, and actually there was a really good graphic in the column as well as online on how to properly remove a tick and make sure that you get that out. But I wanted to just go over a couple other things. We talked about a lot of things. I had limited space in print, and so I wanted to do a little bit more follow-up.
Sure.
So thank you very much for joining me here today. So is it possible to get ticks every time you go out into a wooded area?
So if you're out on your driveway, let's say it's low likely that you will have exposure to a tick. But if you're in a wooded area, especially where you're around tall grass and shrubs, you could somehow lay up against a shrub and a tick can sort of climb on top of you. So it's really going to be in the areas that are really highly wooded and a lot of tall grass and shrubs. Those are going to be the areas. So again, when you do go out in those places, try to use bug spray with DEET is what is recommended to try to prevent from the exposure.
Okay. And then there was also some clothing, perhaps too, if you're a heavy gardener.
If you're a heavy gardener, to use clothing that's pre-treated with permethrin. And also, whenever you do come back into the house after being out in a real woody or grass area, or you're doing some heavy gardening, to remove the clothes and wash them appropriately, and to check your body for any ticks at that time.
And you said hot water for washing.
Exactly.
Okay. We were also talking in the column about how small a tick is. You said it's like a poppy seed. So it could look like a freckle. It could look like...
Right. It can look like a poppy seed, and ticks like to kind of be at moist areas in the body, like under the armpit areas, and sometimes within the groin region. So it's really good, especially with small children, to remove clothing if they've been out with you, and to just kind of take a quick exam of the body to see if you see anything.
Okay. And they're typically not moving on you. They've probably stopped and engorged, bitten you, right?
Right. So they will, not all of the ticks will will bite and get engorged, but you may not really feel them. They're so small, you may not feel it. But and even the bite, once it kind of bites the skin, the tick actually releases an anesthetic, which makes it so that you feel numb in that area. And it can become engorged. When it starts to feed, it can be engorged and be there for almost 2 to 3 days before it falls off.
Okay. And let's talk a little bit about how people are used to like a mosquito bite, or so the ticks don't fly, and I'm not seeing like a welt or anything, or I'm not immediately itching.
No, you're not immediately itching.
Okay.
After having a tick on, you could see some redness at the area, but it's not like mosquitoes where you'll know right away and you want to kind of slap at that area.
Okay. And then also, I think you just mentioned it a little bit here, but so the tick is not necessarily always going to look engorged, right? An engorged tick is after it's been feeding on
you for a while, correct?
Okay. Okay. And is there a life cycle for a tick?
Yeah. So the ones we see in the spring and summer, the deer ticks, are the nymph stage. So it's kind of like the baby stage, and they will feed on a host for about 2 to 3 days, and then they fall off and they kind of turn into the adult stage, which again can feed and then lay eggs and just sort of die, and then those eggs will rehatch and then go into the nymph stage again. So that's kind of how you have the cycle that forms. And we see during the spring and summer is where we see these nymph ticks, and those are the ones that we worry about with the Lyme disease.
Okay. And has there been an increase in Lyme disease locally or nationally?
So locally from 2008 to about 2011, if you look at the from 2011 to 2019, if you look at the Summit County numbers, we have seen some rise. In the last 2 years, we saw a little bit of a dip, but overall from 2011, there has been a rise in Lyme, especially in Summit County, and overall in the U.S., we've seen a rise. There have been we report almost 30,000 cases a year to the CDC, but there have been almost 300,000 a year that are diagnosed.
Well, and are you so when a primary care physician or an infectious disease doctor treats a patient, then do you report that?
We report it to the health. Yeah, we
Okay.
report it, especially if you have a probable or suspected case. You should be reporting it to the health
But then
department.
there may be some people who are not sure that they're never treated, so they're not reported.
Correct.
Okay. And if you've been treated for Lyme disease once, are you at higher risk to get it again?
No higher risk. It's just your risk factors would be being outside, outdoors, and doing the, being in areas that you could be exposed to a tick. So just having it one time in the past does not put you at any higher risk for the second time.
I know we talked about the different types of treatments, that the most typical treatment is if you do within a couple days to a couple weeks, see that bullseye, the target kind of sign, or feel fatigued and get treated, that the typical treatment is some antibiotics.
Antibiotics, correct, for anywhere from 10 to 21 days is
Okay.
what you will
It's just
get.
a pill, like a daily
It's a
pill?
pill, yeah,
Okay.
a pill you will take. Some of the later stages of Lyme disease, depending on if it's involving the heart or something more neurologic, we would recommend IV antibiotics at that time. And again, a lot of this is on the discretion of the physician and the patient. We kind of talk with the patient, and those courses can go up to about a month, about 28 days.
Okay. And then, obviously, I know with any type of disease, it's more rare, but can you talk about some of the more serious things, or could you die of Lyme disease?
Yeah, so some of the serious complications you could see is when it involves the heart, where you see carditis, where you've got a lot of inflammation of the heart. Some of the neurologic symptoms, such as memory loss, you can have some weakness. There could be, meningitis, and one of the long-standing things we see is arthritis can be there as well with Lyme disease. Most of these are pretty much reversible with the treatment, as the treatment is very effective. Death is really very rare to see with Lyme disease, but you could have some complications such as involving the heart or the neurologic system.
And are there areas of the country such as ours that have more cases of Lyme disease?
Yes, so we're fairly, we're not as high with our Lyme cases as much as you would see in the Mid-Atlantic areas, the New England areas like Pennsylvania, New York, New Jersey. Those are the big places you're going to see a lot of the Lyme cases. There are some cases in Northern California as well. So primarily like the north central United States, the Mid-Atlantic, which would be like the New England or the eastern New England area, and then there's cases in Northern California.
And deer is like the big animal that kind of transports the
deer is the host. That's the kind of the host animal.
That's the biggest host animal. Are there other host animals?
I mean, they can always feed on other,
Sure.
Dogs, cats, and stuff. But the deer is the biggest host animal.
Okay. And is there a time of year when Lyme disease is more common?
During the spring and summer.
Okay.
So that's when
because otherwise it's too cold.
Right.
Okay.
Right.
Okay. And I know we discussed this some in the column, but let's discuss it a little bit more here. Some patients may say they have chronic Lyme disease, but the CDC says Lyme disease is not a chronic disease, and the antibiotic treatments are effective. But Lyme disease can trigger your autoimmune system to attack your joints or trigger other chronic diseases, and it might be appropriate to see a specialist and find out what those causes are. One reader after the column asked about post-Lyme disease syndrome. Can you explain this a little bit more?
Yes, so post-Lyme disease syndrome is basically referring to those individuals that have been effectively treated with antibiotics for Lyme disease, and in approximately 10 to 15% of patients who are effectively treated, they could continue to have symptoms for about 6 months to a year. Some articles say even longer than that. So they could have symptoms of fatigue, maybe depression, arthritis, and there's a lot of research in this area as of now, and I know it can be a little bit controversial because the old terminology about chronic Lyme disease kind of implied that there was an ongoing persistent infection. But what the experts believe at this point is that the Lyme disease has been treated effectively, and there could be an autoimmune phenomenon that's still causing these symptoms of the fatigue or the arthritis. So at this point, a lot of research is going on in this area. If you were to have those symptoms, I highly recommend you consult with your physician. And like I said, we've got a a lot of work that's being done in this area.
So you wouldn't, so if you had these symptoms of post-Lyme disease syndrome, you wouldn't get treated again for the Lyme disease, but you would probably talk to an infectious disease specialist to see what else you might need.
Correct. At this point, we do not believe that prolonging antibiotic therapy is effective in this syndrome. The long-term antibiotics, if you were to continue, there's more side effects, and at this point, we try to treat the symptoms and go from there.
Okay, great. Thank you so much for joining me today. I appreciate it.